In the last decade alone, over 25,000 refugees from 42 countries have settled in Michigan, according to the U.S. Bureau of Population, Refugees, and Migration. Although they often flee with little material possessions, refugees and forced migrants carry with them the immense physical and mental health costs of conflict. For many recent immigrants, language and culture can be a barrier in the already complicated process of accessing quality healthcare services. In addition, refugees in particular face unique problems including high levels of psychosocial disorders, PTSD, poor dental health, and malnutrition. These factors can create significant obstacles to the local integration of refugees, preventing them from becoming productive members of society. Despite their need for targeted healthcare services, the Office of Refugee Resettlement, which provides funding and support for recently arrived refugees, recently decided against creating a refugee-specific health and welfare program, in favor of including refugees in the national welfare and Medicaid system. Although coverage for low-income patients is expanded under the new Affordable Care Act, applying for Medicaid remains a lengthy, complicated, and unreliable process, even for those refugees facing urgent health needs. Many refugee service organizations say that this system does not acknowledge the unique situation and needs of refugees. The lack of access to culturally and linguistically sensitive healthcare has tangible implications for refugees, communities, and healthcare professionals alike. Hospitals often do not have adequate translators, and staff aren't always trained to work with patients of other cultures and religions. I have spoken to Somali Bantu refugees in Lansing, Michigan, a community that's emblematic of this problem, given that the Somali Bantu speak a lesser-known Eastern African language and face cultural barriers because of their strict observance of Islam. I have also spoken to Iraqi and Chaldean refugees in Sterling Heights, Arab immigrants in Dearborn, Michigan, and healthcare professionals in Southeast Michigan. This article will not only address a problem that is largely ignored both locally and nationally, that being the lack of access to culturally and linguistically sensitive healthcare, but will also introduce some of the initiatives and organizations aimed at filling this gap. In addition, I will seek to introduce briefly some of the underlying causes of this problem, including the absence of minorities in the healthcare sector as a whole, as well as the incapacity of the U.S. healthcare system to accommodate increasing numbers of low-income patients with special and compounding needs. This piece will use the narrative of 3 of Michigan's refugee families and the organizations and dedicated healthcare professionals that are trying to serve them in order to illustrate the broader story of the implications of diversifying demographics on our healthcare system.